So anxiety shows up for so many of us these days. Sometimes it's a loud and obvious thing. Sometimes it's just a low-level hum that never really goes away. And a lot of us quietly assume that feeling anxious means something's wrong with us. But what if that's not true, or at least not entirely true? In this conversation, I'm joined by Dr. Tracey Marks, a psychiatrist and mental health educator who has spent over 2 decades helping people understand what's really happening in their minds and bodies. She's the author of Why Am I So Anxious? Powerful Tools for Recognizing Anxiety and Restoring Your Peace. This is one of those conversations that helps you feel less broken and more informed. So excited to share this conversation with you. I'm Jonathan Fields, and this is Good Life Project. Let's dive into this topic of anxiety. We are living in a time where I feel like people open their eyes in the morning and without even interacting with anything, any news source, any stream, any person, so many people feel that there's a baseline level of, like there's an angsty kind of thing going on with them. A lot of us talk about anxiety. I am anxious. I feel anxious. It's been, I think, an increasing part of the conversation. But what actually is anxiety? When we talk about anxiety, what are we actually talking about?
That's a great question because we talk about a couple of things. First, there is just the emotional experience of anxiety that everyone has that's not a disorder. It's a normal reaction to fear, a threat, self-preservation, the need for self-preservation. And then when it extends beyond the normative reaction and just is present in the absence of any particular threat, and persistent and causes and interferes with your life, the quality of your life, then it's more along the disorder range of anxiety. It's usually fear-based, but sometimes it is just generalized distress. There doesn't have to be an identifiable stressor that you're afraid of. You can just feel this sense of unease or dis-ease chronically.
When you say it's usually fear-based, take me deeper into that.
So what I mean by that is, one of the brain structures that detects threats for us is the amygdala, and that's kind of what we typically think of as the main brain structure responsible for generating anxiety and generating the brain responses to a perceived threat, whether it's a real threat or just a perception that's not really a threat. And so the concern that something bad is going to happen, therefore I need to do something, whether it be worry or take action, really is fear. You're afraid that something is going to happen. I'm trying to think of a scenario where anxiety wouldn't be fear-based.
So then the main thought then, just from a cognitive standpoint, like the main thing that's going on in your brain is, I'm thinking about the future, and maybe that's a second, maybe it's a day, maybe it's a week, maybe it's a year. And then there's something scrolling in my brain that says, I fear the possibility of this thing that I don't want to happen actually happening.
Exactly. And so that thing could be someone breaking into your home, someone dying. It could be being insulted, not getting a promotion, not finishing your homework. I mean, it could be lots of things.
Yeah. So you also described this notion that we can experience this, and you made a distinction between anxiety and anxiety disorder. Take me deeper into that. Sure.
So just as we can experience happiness, joy, anger, anxiety can be just another emotion. So again, if I am driving and a car runs the light and I almost get hit, that reaction of my chest beating, my hyperventilating, afraid of what could have happened to me, all of that is an anxiety response. But I would expect, in the absence of having a disorder, anxiety disorder or anxiety problem, that as time passes, it'll go away. So I'll recover and get back to my usual routine. I won't be ruminating or thinking a lot about, what about the next intersection? I don't think I can drive now. Like, that is more the pathological response. So I guess a different way to think about this is pathological anxiety that causes problems and that is excessive beyond the stimulus or beyond the trigger, and normal anxiety or non-pathological anxiety that is part of just an emotional response that we should have. Like, I should fear someone breaking into my home or leaving my car unlocked. Those are things that I should be afraid of something bad happening and anticipate that these things could happen, so to protect myself.
So if, for example, I want to make sure I understand this. If, for example, you're walking outside, you're at a bar with friends, you're at a restaurant with friends, you're like on your own, and it's 10 o'clock at night, you walk outside and you have to cross a dark parking lot to get to your car, right? There's probably, a healthy anxiety that says, okay, so I don't know if this is safe or not. So maybe that anxiety, because you're kind of saying like, well, like bad things could potentially happen here. I'm alone. It's a dark environment. It's nighttime. But that's the anxiety where it's kind of realistic. It's in the moment. And maybe that leads you to take some sort of protective action. Maybe you drop back into the bar and you talk to your friends, hey, can you walk me to my car? Or you turn on the light on your phone just so that there's a little more light in, or you talk to somebody on your phone while you're walking to your car, just so like you're in contact with somebody while you're doing it. That would be kind of like, okay, I'm anxious, but that's not the disordered kind of anxiety. That's an anxiety that's leading you to take intelligent action. Does that land so far?
Yes, absolutely. And, another example of how anxiety can be motivating in a good way is if I've got a deadline to meet, I don't want to fail at this task that I'm working on or this project, I might start to feel a little bit or have some angst or anxiety about not finishing this. So I'm going to put my best foot forward and punch it and get this done. So anxiety can motivate us as well to do things that we should be doing.
Yeah. So anxiety isn't always a bad thing, is what
it's not always a bad thing.
It's a signal, and potentially there's a motivational energy to it, which can help us do things we want to do.
Absolutely.
So then how do we know? Let's take either one of those scenarios, right? The work scenario where like there's a deadline, there's a big thing, maybe there's a promotion or a big presentation online, or walking across the parking lot. How would we know when a behavior like that tips from being, okay, I'm anxious, but there's a reason for this and there's a healthy way to deal with it, to this is now disordered anxiety? What would that look like?
Sure. So probably the easiest way to conceptualize this is when the behavior is persistent. It's not necessarily linked to a specific stressor that's right there in front of you, and it causes problems for you. So what could that look like? If we take the walking to my car scenario, yes, it's normal to take precautions and be a little worried or anxious that something could happen to me walking to the car. But let's say it's 6 p.m., it's not dark out yet, and I am, trying to find anyone who'll just walk me to my car. And what if this happens? What if that happens? What if that, blah, blah, blah? And I'm driving other people nuts because I'm like laying out all of these negative situations. We call it catastrophizing, like thinking of the worst case scenario. And that's kind of always what I talk about. Like, I'm always looking at worst case scenarios for things and assuming all these bad things are going to happen. That's a different look to this whole issue of walking to my car by myself. Sometimes people will wake up in the morning feeling nauseous. I was just talking to a patient recently, talking about how their anxiety was kind of ramping up with the new year. And the person was saying, I'm back to throwing up in the mornings. And it's not anything specific, but it's just this free-floating, we call it free-floating anxiety about nothing that you can really lay your hat on, but you just don't feel good. You just feel afraid.
So there's a couple things here then, right? One is if it turns to a point where you find yourself sort of like repeatedly looping through and catastrophizing, and to the extent I would imagine even that, where it's stopping you from doing the things that you actually want to do, and then we're tipping into sort of like the world of disordered anxiety.
Correct, because often, and it causing problems for you. So,
Okay.
when we look at our diagnostic manual that like lays out the definition of different disorders, one of the criteria for pretty much all of them is that it causes functional impairment. That's the terminology that it uses, but it's impairment or problems in different areas of your life. So occupational, personal, and or social. And so, the social aspect could be, for say, anxiety, could be you've become a hermit, or let's say, going back to the working person, you don't go to required mixers because you're just too anxious about what people are thinking about you. And so you come up with excuses of why you can't go. You got to pick up your kid, blah, blah, blah. And it just never works out. You've always got an excuse. But that causes problems work-wise, occupationally, because you're expected to be at these things, these networking events. So, the person without a disorder may still not like the networking, but they can still stomach it. They find a way to get through it. And then once they leave, again, they recover and they can go to sleep at night.
Right.
The person with the anxiety disorder may avoid, or if they can't avoid because they don't want to lose their job, they go, but then they can't sleep that night. Or they wake up and throw up, or, have headaches and things like that, like all of these physical manifestations. So that's kind of the difference in how it could look between the person who has an aversion to something that makes them uncomfortable, but they still do it and they get through it, versus the person who has disordered or pathological anxiety about this thing.
Yeah. I'm actually really curious about what you described as the person who sort of, they actually stop doing all the things, but for each time they opt out of it, there's an excuse that they can point to. Do you find at all in clinical practice, when you're sort of like working with patients, that somebody comes in and this is what they're experiencing? Like they have all these excuses, they're not doing this thing, but they're kind of telling themselves, but these are rational reasons. Like they actually they're not identifying that they're anxious underneath it, or that anxiety is a part of this. They think that all these decisions are actually rational. Like these are all rational, good, solid reasons not to do these things. So, or people generally pretty aware of the fact that there's an underlying experience of anxiety.
That's a great question, because I think that anxiety is probably one of the, I don't know, few, if I'd say few, but like one of the disorders that it's hard to deny. Like people aren't in denial about it. They know that they don't like the way they feel, their heart's racing or whatever the symptoms are that they're having. And so they acknowledge it. They may not acknowledge the extent to which it's keeping them from doing things. They may feel like, well, I got this, I just don't like meetings, so I don't want to go. But I don't know if it's my patients and they're just, self-actualized people or what, but usually we don't have that problem of them saying, I'm not doing X because it makes me too anxious.
Yeah. You also brought up this really interesting example of somebody, I think you were referencing a patient of yours, who kind of just wakes up with this generalized sense of doom, fear, to the extent where it's affecting them physiologically, where like they actually they'll throw up. So is there a distinction then where somebody sort of says, I'm anxious because I'm thinking about a very specific thing, or something happened to me and I'm worried about having again, versus just this generalized feeling of I open my eyes in the morning and I can't even tell you what I'm anxious about, but I am.
So that scenario of I can't even tell you what I'm anxious about, I just feel horrible, or I'm just very anxious, So getting back to the question of people recognizing that they have anxiety,
Yeah.
when people have a predominance of physical symptoms, oftentimes they will think it's something physical and it's not anxiety. So particularly when it has to do with like heart racing or palpitations and things like that, they might feel like, having panic attacks. They'll think there's just something wrong with me. And they may end up in the ER a couple of times until finally someone says, you're all clear. You've had a cardiology workup. You've had all this stuff. It's anxiety. And so I've had people come to me and say, I'm here because the doctor said it must be anxiety, but I know there's still, I just still feel like there's something physically wrong with me, but I get it that, yeah, it does make me anxious.
So here's my curiosity around this. We know in the literature that medical gaslighting exists, and by that I mean practitioners basically telling patients there's nothing wrong with you, or it's, quote, all in your head, or the socially acceptable version of that. We also know from the literature, and I know you know this literature well, that happens to women far more often than it happens to men in the patient seat. Is there a risk here? Like, where's the line between sort of saying, oh, like this is anxiety based, versus there's something real going on here? Because I have friends who have gone to doctors with some of the symptoms you described and been sent to find therapists, and then 6 months later realized, no, there's actually something really physiological that's not anxiety related that's going on here.
Yeah, it gets tricky. I do think on the one hand, you can have people who, clinicians, who dismiss patients' complaints if they know that the person already has a mental disorder. They've got a long list of meds that they're on. It can be easy to say, this person says, well, I've got this stomach issue. Go see your psychiatrist because I can't think of anything that you could really have, or it's probably anxiety or whatever. But, for someone who has symptoms that have not been worked up, another way this can look, or a flip side of this is the reverse, where they're seeing me as their psychiatrist and they're bringing up all these physical things, and I'm saying, before we assume this is psychiatric, you need to go have this worked up. And so a lot of people, if they're in their 30s or so, they may not even have a primary care doctor. And so some of them resist that. They're like, I don't feel like going to the doctor. Just, give me some Ativan to make this go away. And I'm saying that this is why psychiatric patients often don't get good physical care, because of the assumption that it's all mental. Okay, so that's not exactly the scenario you mentioned, but that's another scenario. But yeah, there's the kind of old school terminology that people would use is hysteria, the hysteria of women, and the assumption that a lot of the complaints were just psychosomatic in origin. But I tell you, there's only so much workup a person can get. So if a person, I gave you the example of the person going to the ER a couple times because they think they're having a heart attack when it's really a panic attack. If they go to a cardiologist and they get an echo and they get all of these studies and they're all clear, then what else is the doctor supposed to conclude? So there's a mishmash of like real people getting $1 million workups that come back negative. And so therefore, by default, it must be psychiatric. Let's look into it. And then the people who get dismissed on the other side of the spectrum, who get dismissed because either they've complained about this thing too many times and they can't find something, or they already have a psychiatric issue and it's just assumed that it's more of the same. That said, there's cardiac workups, but I think that are pretty cut and dry. But things like gastrointestinal, right, or maybe some kind of like lupus. That's kind of where my mind was going, right? Yeah. Yeah. Those symptoms, there are things that people can have that manifest, either GI or aches and pains that can get missed simply because the disorder, the disorder that they end up having is not one that's easy to find or to diagnose in the first place, that it gets missed in general.
Yeah. I mean, it sounds like the answer is, it's complicated.
It's complicated.
And at the same time, I think the old line, well, some version of it's psychosomatic or it's all in your head. It's interesting because I think the language has changed around that over the last decade or so also, because that language itself was taken as so pejorative. And also to say, there's nothing wrong with you, go see a therapist. That actually diminishes the fact that there is something wrong,
Yeah.
but maybe it's originating from your psychology, from your brain, more than your sort of like your extended physiology. To say there's nothing wrong with you, go see a therapist, which is kind of the way it was phrased for a long time, is denying the fact that there is actually something happening here that's real. It's just the treatment is more psychological or psychiatric in basis than physiological or like medication oriented.
Right. And I have a little bit more of another cynical view of that is,
Yeah.
and I think that it speaks negatively about how people think about psychiatry in general. I think we've gotten better at seeing the significance and importance of mental health. But even 10 years ago, it's all in your head just means it doesn't really exist
Right.
or it's trivial. And so, but in your head, okay, it's in your head. We have brains inside of our heads, and our
They're
brains are
real.
organs.
Right.
Yeah, our brains are real. So, okay, so it's inside my head. So I think now we have a better appreciation for the significance of mental health as a legitimate issue and thing that we need to pay attention to. And so, if someone has, say, panic attacks, okay, that's anxiety generated, it's psychiatric. It doesn't make it any less real or significant than chest pain that comes from, coronary artery disease.
Yeah.
It's just two different origins.
Yeah, and I guess we all know now, the science is really there now that shows us if in fact the origin is in your quote head, it is also going to be in your body. Like there's no
That's right.
separation. It will lead to very likely all sorts of physiological symptoms. From pain to inflammation to illness to disease. So it's really all just one feedback mechanism at this point that we have to deal with in that way. One of the light bulbs that's going off in my head right now also is going back to, you used the word catastrophizing earlier in our conversation. And what that triggered for me is a curiosity around OCD, obsessive compulsive disorder. What's the relationship between OCD and anxiety?
Obsessive compulsive disorder, OCD, used to be categorized as an anxiety disorder in our diagnostic manual, probably like we're at the 5th edition now, so 4th edition and before. With the 5th edition that came out in 2013, it was removed from anxiety disorder classification and put underneath compulsive disorders, along with some other things. That's just kind of a nomenclature issue as far as I'm concerned. It's still driven by anxiety. So, in general, it's still really an anxiety disorder, but it just, has this additional element of compulsive behaviors that can come along with it.
When we talk about all the different ways that OCD and or anxiety can show up, and the origins, and you described some of the ways that like thoughts can lead to these different things. Fears can start to become the genesis of these different things, the feelings in our body, in our mind. Is there, and that sounds largely the way that we relate to our environment, is there a genetic element to any of this?
Oh, absolutely. Yeah. Anxiety disorders, pretty much, I think most of the psychiatric disorders, but anxiety disorders run in families. I couldn't give you percentages, as far as, as far as how it's passed down. But yes, you have anxious. So there's a couple of things. You have anxious parents can produce anxious children, but also you can learn to be anxious based on how you're raised. So, sitting around the dinner table, hearing parents fret over this and fret over that and whatnot. And we can't make a decision because we just don't know. You can kind of learn that, learn to adapt that way. Also, another genetic component is some people have less tolerance of uncertainty. That's thought of as a temperament, kind of genetic thing or predisposition. So the idea of we don't know what's going to happen in 2026 with the way things are going right now. Okay, there are some people who can just go through each day recognizing that there's this level of uncertainty and hope for a better tomorrow. And then there are people who, going back to the sleep, aren't sleeping at night because they're worried about whether or not they're even going to have a job tomorrow. I mean, even if that's for a lot of people, that's a real thing. But even if that's not a real threat, that no one's ever told them that they may lose their job, they just might, just because of how things are, kind of thing.
Yeah. So there's this balance then between there may be some genetic determination or bias towards it, leaning towards the propensity for anxiety, and environment also plays a really substantial role. And sometimes it's both. Like you said, maybe actually there's some genetic element to it, and then maybe you're sitting around the table with your family and you have parents who express anxious behavior as almost like a way of being, and that becomes like the family culture. So it gets passed on to you in different ways. And which, if you're a parent or somebody who's in a caretaking position, that's a big thing for you to think about.
Yeah, you're just kind of like making your child be as anxious as you. I mean, some people can fight against that, and their tendency may be to not want to commit because you just never know. But at the end of the day, they can, versus the person who it really does struggle with uncertainty, and so they can't commit.
Yeah. So we know that anxiety is a feeling that's common across, at some point, probably everybody, that it's not always a bad thing, that sometimes it's a completely rational and helpful and constructive reaction, that sometimes it can give us energy and motivation, but then it can also tip into disorder, which stops us from living functionally, living the way that we want to live, that there are multiple contributors to it. Let's talk about if we feel like it's tipping into this part of our life, where it is stopping us from showing up the way they want to show up, participating, from doing the things that might open opportunities to us, what we can do about that. You're somebody who lists out a whole bunch of different sets of options or tools. And before we even go into some of the individual areas or categories, my understanding is that you're not necessarily somebody who says, okay, here's the one thing for you. But oftentimes it's kind of like, what is the basket of things that will make most sense for you? Is that right?
That's right. I can't tell you how many times I've heard people say, well, I've tried all that stuff. Well, there's so many things you could try, number one, but it really isn't about this one thing will erase all of your anxiety. It's what works for you. So, for example, breathing techniques. Some people, we know that it's effective, but still, for some people, they just can't implement it in the time at the moment, or they just don't feel a lot of it just doesn't resonate enough with them to practice it, so that in the moment it will be just a knee-jerk response. So that just might not be a tool for you. Versus something like and meditation, I think, kind of falls into that category too, because it requires a certain amount of discipline to practice it, get good at it, so that it becomes knee-jerk for you. But for people who it does resonate with them, they can tell you, I'm at so much more peace now that I do this. I, carve out this amount of time every day, 10 minutes, and this is what I do, et cetera. So it really is about trying to find things that work for you and having them at the ready so that you can implement them at the time. I do want to add, though, that I tell patients, the ones who are taking medications for anxiety, that like if I start someone on a new medication, I'll say, okay, so let's just get straight here that the goal is not that you are anxiety free. That's not a reasonable expectation. So whether you're taking medication or whether you're using tools, if you've got an anxiety disorder, or you've got a lot of anxiety, we'll just say, instead of getting away from this disorder issue, anxiety tends to come and go in waves. So you can have periods of your life where it's manageable, meaning, let's say, during the day you start to feel the tightness in your chest or muscles tight, but, you power through, you get your work done, or you go run after work and you kind of relieve some of that tension and now you feel better. And that's how you're managing it. And then other times where it just overwhelms you and you can't manage it alone. So maybe then you take medication. But even so, with the medication, still the expectation isn't that if, someone bursts into my house holding a gun, then I'm just going to be like, hey, what? Thanks for coming. You're still going to have an anxiety response. So we should never expect to be completely anxiety free.
Yeah, I mean, and that's such a powerful thing, I think, expectation to set. Because I would imagine people do come to you often and say, I just want this gone from my life. It's disabling. I can't live and breathe the way that I want, and I just need it gone. And as you described earlier in the conversation, we actually don't want it entirely gone. It plays a really important role in us being safe and intelligent and inviting really good things into our lives. It's when it tips into that area where it's disabling in a lot of ways. But that must be also a bit of a weird conversation to have someone who comes to you, or like trying to convince them you actually don't want it entirely gone, or the expectation shouldn't be to make it go away. Especially if somebody's deep in anxiety or in the throes of repeated panic attacks, I have to imagine that person's like, no, this has to go away, like forever. I don't ever want it. Like, give me whatever I need to do, whatever level of medication, whatever practices. I just need this entirely annihilated from my life.
Yeah. So then we have to have a different kind of conversation about having reasonable expectations, because that mindset of, I don't want to feel anything unpleasant, so give me something so I don't have to feel anything unpleasant. It can lead to addictions because of this idea of, I don't want to have to cope on my own. I want something to just take it away. So I try and help people shift from thinking that way of everything has to just be taken away with a pill of some sort. But what makes that palatable or makes them able to accept that is, well, let's look at what do I actually mean by you're still going to have some anxiety. Well, what's bearable anxiety? Maybe feeling a little tense at the thought of doing XYZ, but once it's over, okay, I'll be all right. Well, that's normal anxiety. So, okay, you can live with that versus if someone, the plea to take this all away is usually for the more intense, severe manifestation, like the panic attacks or, the inability or feeling unable to go anywhere or drive your car because of some fear or something. Like that's the stuff that they want to go away versus any unpleasant feeling.
Yeah, that makes sense to me. Let's talk about some of these major categories. Why don't we start out with medication, because we've referenced it a number of times now. And also, this is a category where a lot of people, there's a shame associated with it for a lot of people. Like, oh, like you quote, shouldn't need that. Or there are all these other things that you can, quote, do first. Talk to me about anxiety and medication.
Yeah. So, You made me think about something with as far as the shame and guilt about, well, I must not be doing enough to need to take medication for this, or I'm not crazy. So crazy people take medications, like all of that kind of thinking. I think we've gotten better with that over the years, with more people speaking out about taking medication for something, whether it be depression or anxiety. So I think we're getting better, but there's still in certain communities and certain cultures where if I'm a Christian, and I think about in Christian culture of, if you trust God, then why are you anxious? Versus, I'm anxious because this is a physiological reaction. Okay, so I went down a rabbit hole. Sorry about that. So,
No, but it's good because I think these are actually the real things that come up when somebody is dealing with this. And it may be some of the internal and also external pressures that come their way, or judgments that come their way, that might stop them from considering something that actually might be appropriate for them, at least for a moment in time.
Exactly. So, for daily anxiety, the recommended medication are antidepressants, actually. Antidepressants we use for both depression and anxiety. There's another one that's a serotonin agent that's not really an antidepressant, though, but it's similar, and that's called Buspirone. But these medications you take every single day because you have anxiety every single day. Some people would prefer to take sedative-type medications like clonazepam, Xanax, or alprazolam is a generic name for those, because those medications kind of work like pain pills, where you take it and within 30 minutes, poof, you feel so much better. They're pretty much like prescription alcohol because they work similarly in the brain. And so you get that instantaneous or immediate relief. Those pills, because of the way that they're structured, can be habit forming and lead to a dependency on it. So then if you stop taking it, you can get withdrawal and all of this. So those are the kind of medications that are best taken as needed and not every day. So let's say I get panic when I fly. Okay, you get a bottle of Klonopin or Xanax that lasts you a year because you fly 3 or 4 times a year, and that's the only time you take it. Or even a panic attack, every now, like maybe once a week or something, and you just take it and then it makes it go away, and then the rest of the week you're good. But if you have a daily experience, it's best to take the medications that are intended to be taken daily. There's downsides in that, aside from the idea of buying into, I'm taking a pill every day, this must be, because another thing about the as needed pill, I think there's the perception for the person that I'm not that bad because I don't need this all the time. So I can just take it every blue moon. Whereas to take something every day means I've got like this chronic illness. I'm taking a pill every day. So at any rate, even once you take something every day or take one of these medications, they can have a lot of side effects, like dulling your emotions or giving you gastrointestinal problems and dry mouth and things like that. And sadly, when those side effects occur, it just can reinforce this idea of, why do I have to take medication? How do I have to deal with this every day to deal with my anxiety? So, for people who experience side effects from these medications, they can end up going on and off of them because they just don't like the experience.
When somebody is taking the sort of like the daily, and again, I want to make it, I think it's clear to anyone joining us for this conversation, this is not individual medical advice. This is just sort of like a general exploration of what is available in different categories. But one of the things that I've heard from people who resist the sort of like starting on something daily is, I don't want to be on this for life. Are these sort of a class of medications something that most people are on for life, or is it sort of episodic? And if it is a long-term or a lifetime thing, is that okay?
The answer to this question goes back to what I was talking about, anxiety coming and going in waves. So, and that wave can be really long, and the interval in between the waves can be long enough such that, so let's say you have just this really stressful period of your life, and you have unmanageable anxiety, you get on medication, you're on it for a couple of years, and then things kind of settle down. You're in a steady job, the kids are out of the house or something, and just life is more calm for you. I talk with patients about, okay, let's see how you can do without the medication now. and they get off and see if they can kind of wing it on their own. And they may wing it on their own with mild levels of anxiety or anxious moments that they manage with behavioral things like the exercise or the meditation or whatever it is. So lifetime could be in and out of, or chunks of time that you take it and then you get off, take it and then you get off. For some people, though, going back to this isn't medical advice, that doesn't work for everyone. There are some people with debilitating enough anxiety that's daily that it could mean a lifetime of medication. It's hard for me to sign somebody up for lifetime if they're 38 years old saying you're going to need this every day for the rest of your life, because I don't know what their life is going to look like. Yeah, they could, again, retire and have a chilled life every day. And so they can just deal with the occasional stomach upset that they get when they hear something on the news.
Yeah.
Or occasional bad sleep that they can have because their mind was racing. But things like obsessive compulsive disorder, oftentimes those symptoms can be not manageable enough without medication to need medication. I know we're talking about medication, but OCD doesn't always respond well to medication, and sometimes people need more behavioral treatment for that. So the long and the short of it is that it depends on how the anxiety manifests. One more thing. So someone with social anxiety, let's say, with social anxiety, people are preoccupied with what people think about them and people's judgment and things like that. So it's not just social, like I just don't like crowds. It could be worrying about what someone's going to think when you're talking to them, even one-on-one. It's called social and performance anxiety. The performance could be speaking up in a group. So I work and we have, a Zoom meeting and it's my turn to present. Like I could get choked up and can barely speak. Like that could also be social anxiety. So all that to say is I may go through a period of life where the stressors on me or the things that I do make my social anxiety really get in the way of me functioning. So I get treatment for it, whether that treatment be medication or something behavioral. And then I switch jobs. I'm working at home. There's not a lot of things that trigger me into having panic and things. And so I don't need medication during this period of my life.
Yeah. So it's very individualized. And even for an individual, this may shift in really meaningful ways based on the moment or the season of life that they're in. There's really no way to say at the point of intervention or prescribing, like how long or what the dosage is going to be. It's just important to really keep tabs on it, it sounds like, and adjust as needed along the way.
Absolutely.
Yeah.
You said it perfectly.
You brought up a number of other tools also to potentially bring into the toolbox here. And I think, a lot of people, when they think about anxiety, one of the first things they think is, like psychology and oftentimes CBT or, like that sort of behavioral therapy is something that's been brought up a lot. Mindfulness-based cognitive behavioral therapy also is something that I think we've heard a lot more about over the years. What does that look like and how does it actually work? That may be too big a question, but let's see what we can do with it.
Yeah, a little bit, but I'll narrow it down.
Okay.
So it just depends on what you're trying to address. So for example, someone who's got we call it phobic, who is avoiding things because of their anxiety. So let's go back to the social anxiety. Is someone who just cannot stand the idea or just make themselves go to some event, and is becoming a problem because, the family wants me to be there for the soccer game, but it just makes me want to throw up before I go. So, but I want to see my child at the soccer game, so I got to get past this. So a behavioral intervention for that could be what's called gradual desensitization, or just a desensitization process where you like, if my fear, you look at what the ultimate fear is. The fear is being at this place with people talking to me and me having to talk back to them. So if I've already started avoiding going to these things in a way that I start feeling anxious even getting in my car, then that's where I would start. I would start with these exercises of getting in my car. I'm going to drive to the place, or even getting in my car, dealing with the anxiety I feel about that. I'm safe. This is okay. And then going back in the house and like doing that until I'm desensitized. It doesn't make me that anxious anymore. Then I go to the next step, be driving to the place. The next step beyond that might be going to this event and being so far in the back that I'm not challenged to having to talk to people, or, I'm just kind of making this up. But the idea is little baby steps that you practice to get yourself to where you can tolerate it without all that anxiety, and you're no longer avoiding. Because when you avoid things, the fear just grows. It gets bigger and bigger, and it becomes even more of an obstacle to get past. So, desensitization could work with something like that, where there's a phobia, the thing that you're avoiding. It can also work with certain types of trauma, although that would still be kind of a phobic avoidance thing. So you get in a car accident, and now it's hard for you to get behind the wheel of the car anymore. So you work through different steps to get comfortable getting in the car. So that's one type. I don't do, even though trauma is no longer, like PTSD type stuff isn't really considered an anxiety disorder anymore. It can come with a lot of anxiety. And so I don't do trauma-based therapies, but specific trauma-based therapies, I think, are what are needed to address trauma and anxiety related to trauma. And some of those also involve kind of exposure type therapies, we call it. So the desensitization, exposure, kind of different sides of the same coin, of re-exposing yourself to these things that cause you a lot of fear and distress because of it causing you trauma in the past, and doing it in a way that you eventually overcome that fear of being exposed to it.
Yeah. So it sounds like a lot of what this is about, and tell me if this is off or if it's sort of like on. You think about the thing that causes the anxiety, you chunk it down into a series of tiny little steps, and then you start with sort of like the most accessible, the tiniest little most accessible step that would start you towards that experience or towards that thing. You do that and kind of see how you feel until you're comfortable with that. And then you add the next tiny step and the next tiny, and each one kind of waiting until you're comfortable before adding the next one. But I'm guessing also part of this is again, going back to that thing that you would tell patients up front, which is you're not necessarily looking for zero anxiety, right? Along the way, you're looking for, okay, I'm anxious, but I can handle this. Would that be right?
That's right. Yeah, it's a tolerable level of anxiety.
Okay. Yeah, that makes sense. Let's talk about some tools here also. And I guess these could kind of fall under CBT because they're often offered in that context, but I think a lot of these tools also people explore on their own. You mentioned one of them earlier that a lot of people still roll their eyes at, which is either meditation or mindfulness. Talk to me a little bit about this and its relationship in the context of anxiety.
Sure. So with mindfulness is really it's a general category really of essentially your state of mind, but and not necessarily a meditation of sorts, but nonetheless, people will say mindfulness meditation and things like that. But one of the things about anxiety and fretting and worrying and ruminating is that your mind is not in the present. You're either worrying about the past, worrying about the future, ruminating about the past, but you're not here. And generally, the present moment is safe. I mean, if it's not, then, we got bigger problems. But generally, our minds are somewhere else and the actual moment is safe. So a person who is, let's just say, tightly wound, always feeling anxious or always feeling uptight, they may not see themselves having an anxiety disorder, but they're just kind of generally uptight. One of the things that they can do without realizing it is spending too much time not in the present, but thinking about other stuff. And that's taxing on the brain. That's taxing on our minds and can cause internal distress. So the way to offset that is to intentionally bring yourself into the moment. And there's different ways to do that. But let's just say I'm washing dishes. And I'm guilty myself. I'm washing dishes. I can be thinking about, okay, I got this to do, I got that to do, da, da, da. And so the experience of washing dishes isn't a real experience. All it's doing is giving me an opportunity to worry about all the stuff I got to do and all the stuff on my to-do list. Instead, I get out of my head that way, bring myself back into the moment of using all of my senses to experience the current moment. What's the temperature of the water? How does the plate feel? How hard is it? The suds, all of that takes the burden off of your kind of executive functions of keeping up with all this stuff and allows it to just focus in on a singular thing of the present. And it's calming in a way of slowing your mind, not so much calming because I'm not anxious. It's a way to slow your thinking and your processing, and therefore be a calming experience for your body in general. But that's a very simple thing that anyone can take with them and do at any time. I suggest trying it sitting at the traffic light. I've had to force myself, probably like other people, if I'm at the traffic light, not to grab for my phone and see if I have any texts come through. Stop that. Just how long can you sit at the traffic light and just look at the light and look at is it dark outside? Is it, look at your environment. Most people probably don't do that. Their mind is somewhere else. So being in a perpetual state of your mind is somewhere else is mentally draining, and it lessens your, chips away at your mental resources to be able to handle the daily stresses of life.
Mm. Yeah, as you're describing that, I often, when I'm standing in line waiting for a cup of coffee, and if you look at everybody else there, every single head is down in their palm looking at the device. And just as a practice, I'll be like, okay, so this is probably anywhere from 2 to 5 minutes before I step up and place my order. I'm going to challenge myself just to keep my device in my pocket. It's remarkably how hard that is.
It is.
It's like it's calling to me. It's taunting me, and everybody else is doing it, so I have permission to do it. But you really do feel, and all of a sudden I'm like, oh wait, I'm looking around. I'm smelling the aroma of the beans. Somebody's got a yummy scone that's being warmed up. I'm hearing the conversations and the music. I'm like, this moment's actually pretty sweet, And when you really do that, I agree. I think at least for me, it just helps me kind of downregulate a little bit in the moment. And also it just helps me notice some of what's right around me in the moment too, which is something I think oftentimes we just kind of ignore along the way.
We do. And, then life just passes us by because we're not in it. We're just thinking about it, either retrospectively or worrying about the future.
Yeah. I want to talk a little bit also, you referenced earlier, maybe you go out for a run and that helps you for a moment. There's sort of like a body-based set of tools here that are available to us too. What is the relationship between our physical body, and especially ways that we would exert ourselves physically, and anxiety?
So exercise is a good thing, not only from the perspective of staying in shape and all of that. Exercise actually releases endorphins. It releases endocannabinoids, which is like your body's own CBD, which is actually thought to be more responsible for the relaxing or anxiety reducing effects than endorphins are. The whole runner's high, it's actually thought to be more related to endocannabinoids rather than those. But at any rate, and then it also activates BDNF, brain-derived neurotropic factor, which then affects your brain's wiring. And that's a whole nother big topic, but suffice it to say is the better, the tighter and the more connected our brain circuits are, the better we think, the better, the better our brain is able to control our mental health and physical health and all of that. So we like the idea of doing things that promote neuroplasticity or promote regeneration of connections in the brain that promote adaptive behavior. That's a mouthful. But so exercise, long story short, exercise is one of the things that can trigger or promote neuroplasticity and promote brain health. Another kind of body focus, which people probably don't always associate this with mental health, is your gut health. So the whole gut-brain connection is real. Paying attention to the constitution of the bacteria that we have in our gut by eating whole foods and less processed foods, less sugar. I'm guilty of eating the sugar, even though I know it's bad for me. Like all of that stuff, if we have good bacteria in there that then sends signals, healthier signals back up to the brain through the vagus nerve, that is also a way to promote good mental health and reduce anxiety, since that's what we started out talking about, by adjusting your diet. And kind of the easiest way to do that, there's lots of different diets out there, then this isn't about what diet is better. The moral of this story is the best way to do that is reducing processed foods and eating foods as close to their natural state as possible.
Mm. So it's almost like you can approach this from the brain out, or you can approach it from the body in. It's like the body will sort of like reverse its way up into effectively helping the brain rewire to be able to deal with anxiety and feel calm more readily.
That's right. One of my favorite of the body tools that I talk about in my anxiety book is weighted blankets. I love my weighted blanket. And weighted blankets work through deep touch pressure receptors in our skin to kind of send positive signals back up to the brain. That's just kind of a generic way of explaining it. But, the concept of, I know every time that the 4th of July comes around, I see these advertisement for thunder vests for your dogs, for the ones where the noises scare them. But the idea is that you have this compression around their body, and it's the same concept. So with that is calming. So, if you have trouble falling asleep at night or just feel, just want even just a better sleep, I would highly recommend or suggest the use of weighted blankets. And the ideal is that it is 10% of your body weight. But the common weights are like 10 pounds, 15 pounds. And it just kind of wraps around you and has this like cuddling effect that's similar to, swaddling.
That's
with
what
infants.
I was just thinking. Yeah. It's like, what do you do with an infant, especially? And as soon as you swaddle an infant, it's like, it's almost like you watch this baby exhale and they get really calm and just like, oh, I feel safe. And I guess that instinct is still inside of us for as long as we're there. Yeah. That's wild. I do want to ask you one final thing about potential tools here. We live in the world of AI, which is causing mass disruption, and also is stirring a lot of anxiety in a lot of people, because it's sort of like making a lot of people feel like I don't know what the future holds in so many different ways. A lot of times people are focusing on their work, their jobs these days, and what's it going to do? Is it going to take all of that away? I don't know how, if you spend time thinking about this or exploring it, but do you see a role for AI on the opposite side? Is there a therapeutic role that you see AI potentially playing in anxiety?
I do. And I don't have it fleshed out as to actually what it would be. I've just seen, kind of on the clinical side, I've seen programs and things that are embracing AI to make it kind of be like a therapy substitute. I mean, even before AI became very popular, I guess like around 21 or 22, there was already a precedent for online cognitive behavior therapy that was based on like computer models delivering this. So, but this was way before OpenAI. So now, I have seen similar applications and I don't know how experimental it is yet, of using AI to help deliver cognitive behavior therapy. And I'm sure there has to be lots of safeguards around it to make sure that it's accurate and all of that. But I think that companies that are focused on making the AI for that purpose are putting those safeguards in place so that you can rely on the information being reliable. Whereas now, there are people who are using it to be like a therapist for them. But, having chat say, oh, you're so wonderful and all that, that's not the same as a trained therapist. So I think there's lots of room for us to be able to incorporate the knowledge of a therapist combined with AI to be able to deliver something that is better than what we've had thus far, that could meet the needs for a lot of people who can't afford to pay $200 a session.
Yeah,
or more.
And that's what was in my mind as you're describing that. I'm like, okay, just on an accessibility level. And again, it's a wild, wild west now. It sounds like still, but 2 years from now, 3 years from now, 4 or 5 years from now, maybe we have the guardrails and the efficacy where it could really make a difference, especially for folks who aren't resourced on a level where they can find somebody that they can easily get help from on a regular basis.
That's right. That's right. So I think it's something to look forward to, not something to be afraid of. So, yeah, I'm looking forward to seeing what we come up with.
No, such an amazing time to be exploring all of these things.
It really is.
Feels like a good place for us to come full circle in our conversation as well. So in this container of Good Life Project, if I offer up the phrase to live a good life, what comes up?
Spending time with people who matter and doing something good out there in the world, like leaving something behind that helps people.
Thank you. If you haven't yet subscribed to the show, it would mean the world to me if you took just 2 seconds to tap on that subscribe button. It helps us grow our Good Life Project community and continue creating the best possible show that we can for you. And it ensures you'll never miss an episode.